Okay, so I think we're going to get started here. If everybody could have their camera on, if you can, I'm going to be taking a photo at the very end. If you want to be featured on the website, please have your camera on. Just a reminder that you need to attend at least 3 poster sessions in order to receive credit. And I want to give Rhea all the time that she needs for this presentation. So without further ado, you can go ahead and share your screen, Rhea.
Awesome. Okay, let me just. Okay. Okay. Alrighty. So, hi everyone. My name is Rhea Vikas, and I'm a freshman medical humanities major at Baylor University. So today I'm going to be talking to you guys about a holistic treatment plan that is music therapy, and how that there is a lack of awareness that music therapy really is an option for tackling Alzheimer's disease, and what I created to kind of mitigate that issue amongst Alzheimer patients' family members. Okay. So over here, I'm going to give some contextualized information about how the brain looks on thermal brain scans and kind of make some correlations and some hypothesis based on this. So on the left, if you can see the brain at rest, it's pretty dull, not much brain activity per se, not a lot of variability is going on, and the colors are pretty light. It's at rest. And the normal brain, when it's reacting to music, however, can you see that another color has just occurred on the brain scan? The brain has also gotten bigger in this sense, and the colors have gotten deeper. All of these are indications that there is much brain activity going on. With this being said, let's go move on to the Alzheimer's diseased brain. So in the middle of the Alzheimer's disease brain, can you see it's black? So there's not much, actually little to no brain activity that is going on in the temporal and frontal lobe of the Alzheimer's disease brain. So one can hypothesize though that, do you see how much brain activity, the deep colors that are going on when the brain's reaction to music is occurring? From that hypothesis, we can assume and actually prove that Alzheimer's disease brain, when it's reacting to music, there could be some brain activity going on when music is being targeted in this brain. So what is music therapy? Music therapy is the evidence-based clinical use of music intervention by a board-certified music therapist to address the physical, emotional, cognitive, and social needs of the individual. So just to sum that kind of up, music therapy, when done by a board-certified music therapist, addresses all aspects of health. So on the right, let's look at the brain areas modified by music therapy. I want to kind of focus on the hippocampus majorly, because the hippocampus is, as we know, the hippocampus is the structure in the brain that is correlated to memory and retention and past experiences. One of the biggest symptoms of Alzheimer's disease is the lack of memory cognition. So as we know now, music targets the hippocampus. So we can make that correlation on how that will also happen in the Alzheimer's disease brain. So with all that information about the benefits of music therapy, why aren't people going out and putting that as their treatment option for Alzheimer's patients? Well, here are 4 reasons why. Number 1, people put too much dependency on drugs. They think, let's just dope them up, let's put a bunch of drugs in them, alter their chemistry in their brain to see if magically poof something will work. That can't always be the approach that we use with our elder patients in society. Number 2, unawareness of music therapy as an option. A lot of physicians, healthcare professionals, nurses, caregivers, they don't talk about it because they don't know much about it themselves. And 2, once again, with the fact that they just want to drug them up and hope that their brain chemistry will change and it works out for them. We need integration of both holistic and physical medicine. Number 3, a lot of music schools don't offer music therapy as a major. They don't offer it as a secondary study or a minor. And that is restricting board certified music therapists to actually get professionals to pioneer this field. And number 4, the lack of confidence among people that music therapy works. A lot of Alzheimer's patients' family members don't think that this will work because there's a lack of confidence. With this being said, I went and I interviewed a board certified music therapist in Florida who told me that what are the misconceptions of music therapy? What type of individuals benefit from music therapy? What resources are necessary for a professional that wants to make a difference in music therapy? And what positive contributions a student like me can make to advance music therapy awareness. And what I learned from here, and all the issues that regarding the lack of awareness of music therapy, I went ahead and I devised my own website. So my website is a one-stop shop music therapy for Alzheimer's website that is simple, easy to use, target specifically for Alzheimer patients and their family members to understand the effects of music therapy and how you can get involved in setting up a treatment plan for your loved one. And lastly, it is a resource-rich information source that can help bring awareness to really what is music therapy, because through my interview with Ana Alice Lopez, she is the board certified music therapist in my study, she told me that there's so many misconceptions, and on my website I tailor into understanding and making sure that people are not misconceived on what really music therapy is. So a little bit about my inspiration. I have been a volunteer musician and entertainment director coordinator at the Autumn Grove Alzheimer's Center in Katy for about 7 to 8 years. I interacted with patients and I saw when me just playing my cello alone, playing songs that from the 50s and 60s when they were, about teenagers, how they reacted to it. And at the end, I'll have a video. I'm not sure if the audio will work, but on my website, when I do post that link, you can see the video in full on how it actually does help with memory and cognition with these patients. So my product feature, I will also provide website screenshots after this, but it's an Alzheimer's Ready music therapy knowledge site. It is easy to understand and targeted specifically for tackling Alzheimer's, communication option with a board certified music therapist. That means if you are an Alzheimer patient's family member and you want to get in touch with how to do a treatment plan for your patient loved one, then you can contact this music therapist and she'll get you to someone who can help. And there's various videos demonstrating the power of music for Alzheimer patients. So here's a QR code to the website. I think it was also shared in the link in case you wanted to look at that at the end of this presentation and whatnot. So here's a screenshot of number 1. As you can see, it's very easy to understand. There's different paragraphs, so it's very easy to highlight the really important stuff on what is music therapy. Then through a meta-analysis that I did on music on the Alzheimer's brain, I then put 5 points that I felt from all of those studies that I read that are easy and they hit and they target the main points on why music is important on the Alzheimer's brain. And I've also provided that figure that I put in the beginning part of this slideshow. Then these are the videos. There's a video page of a video that I was playing for the Alzheimer patients before COVID, and then videos taken during COVID-19, and how we employed a music therapy virtual program at the Autumn Grove Cottage in Katy. And then this is the page for emailing a board certified music therapist. And Ana Alice Lopez, she works at the House of Music Therapy, and she is willing to help any Alzheimer patient's family member who needs any help regarding the process of providing holistic medicine in their treatment regime. So my next research steps, I would want to, this is a longitudinal study. It's not over yet. Alzheimer's disease isn't gone. So I need to also ensure that we get more awareness out there that Alzheimer's disease and music, there is a correlation. With that being said, I want to update the website and put more information regarding how music therapy is now becoming more incorporative in other neurodegenerative diseases as well. I want to have the process for creating personalized playlists by integrating caregiver and patient together. That can make a more intimate relationship with both the caregiver and the patient and making a more personalized approach for the music therapy. Explore more virtual interaction options for patients because we are still in a pandemic and we still need to figure out ways. We cannot just leave these Alzheimer patients in the dust. We have to figure out ways to incorporate virtual options of music therapy. And lastly, put more board certified music therapists on my page so they can contact individuals, not only just Ana Alice Lopez, but I want to get more board certified music therapists that are hitting every section of the United States. She's from Florida. I would want some from New York, California, Texas, Minnesota. I want it all across the United States. Here are my acknowledgements. My mentor, Stacy Lake, who has really helped me a lot understanding music therapy and really giving me the motivation to go about doing my research and meta-analysis. My subject matter expert, Anna Alice Lopez. She is the board certified music therapist who I interviewed, and really she helped me out understand a lot about how music therapy works with Alzheimer's patients and how it works in the sense of neurodegenerative diseases. So here's the video, and the QR code is on the top. So if you can see, the lady is singing while the man is actually tapping on the table. These two parts are actually cognitive reflexes when the brain is actually employing activity in Alzheimer's diseased brain. So it's actually provoking much brain activity in these two patients. So the entire video is actually on my page if you choose to check out the website. Any questions?
Does it matter like what kind of music you play? Like, does it have to be something they're familiar with or they like, or is it just any kind of music in general?
So that's why I wanted to create the personalized playlisting approach. We want to create a more intimate base between it does matter. If you are talking to a patient who was a teenager during the 50s and 60s, and that will relatively be different amongst all patients. So that approach, it does matter, and that is why we want to employ the caregiver patient approach to figure out what they do enjoy and how we can employ that with the music therapist.
Thank you. That's awesome.
If there are no further questions, Rhea, thank you so much. If you could stop screen sharing for 1 second. So I'm going to take that photo that I was talking about earlier. If everybody who doesn't have their camera on could turn it on if they can. For those of you that do have your camera on, you can do a sick'em or just smile, whatever you're comfortable with. So I'm going to take the photo in 3, 2, 1. Okay, thank you all so much for coming to this session. You're free to go on to your next session. If you guys have done 2 already, then you will have 1 more left. And the sign out form is in the chat if you have not already done so.